Hi, I'm Sharon. She's Ginevra. We both have personal and professional expertise managing fibromyalgia. Let's talk about something that doesn't get talked about nearly enough in fibromyalgia: sex and intimacy. If your desire has changed, if sex feels painful, or if you're simply too exhausted to even think about it, you're not alone. Today, we're breaking down the top three fibro sex blockers and what you can do about them.
We're going to approach it from a medical perspective, but if the topic in general makes you uncomfortable, this might be an episode to skip. And we'll see you in the next one. So I kind of categorize the fibromyalgia sex blockers into three categories. So fatigue, pain with intercourse, and then low libido. And we'll dive into each of those topics today and give you some more information. I also have a lot more information in some blog posts on drginevra.com. So fatigue, let's talk about fatigue. Fatigue from any cause, including fibromyalgia, will really wipe out interest in sex because when you are exhausted and foggy and climb into bed, activity of any type, even a pleasurable activity, is just not going to win out over sleep. I kind of think about Maslow's hierarchy of needs. If you've ever seen that, it's like a triangle and it's kind of the basic human needs are first, we have to answer our needs for food and sleep. And then second, for safety and security and employment. And then only third, when we have those two covered, that's when we really have the intellectual or bandwidth in our life to even think about or work on intimacy and connection. And I feel like in fibromyalgia, we're sort of stuck in those first two levels. Another way to think about it is with our favorite analogy, spoons. So if you have used up all your spoons every day just surviving, there's really no spoons left at the end of the day for anything extra, any extra activities like sex. And I think that's certainly something I've experienced in my life is that I just don't have, I can choose to spend the spoons possibly on sex, but I also really need to make sure that like dinner is on the table. I have to prioritize that. So anything we can do to treat or improve fatigue can translate into more energy for sexual activity. The first thing I think about in that is trying to improve sleep, that other bedroom activity. And we know that in fibromyalgia, our sleep is really poor quality. And there's a lot of approaches, things that you can do, both kind of behaviors, habits around sleep, and then also working with your doctor for looking at different medications. I actually have a whole page in the Fibro Manual that really breaks down the three categories of medications and supplements that can help with sleep. I think that can be pretty huge. And then the other thing is trying to remember that in fibromyalgia, our nervous system is constantly in that fight or flight mode, that danger mode. And when you're in that mode, you really don't have, your body's not wanting sex, really drains any sexual desire. So I like to also think about trying to find ways to bring in some relaxation into your nervous system to kind of allow arousal feelings to arise. And in fibromyalgia, we may have to do that really intentionally. You have to really convince the brain to let its guard down. And that could be like deep breathing or gentle stretching or yoga or laughter or meditation and taking a bath. They're all ways that we can move our nervous system more into that relaxation mode. There's also some types of medications that we use commonly to treat fibromyalgia that can block sex drive, in particular antidepressants. Anything that raises serotonin levels in your brain can both lower your sex drive and also make it more difficult to orgasm. So this is something that's super important to talk about. If you're experiencing that, talk about it with your healthcare provider because you might benefit from just changing the medication, lowering the dose, or even adding in, there's a medication called bupropion that we add in often. It kind of counterbalances some of those sexual side effects from the other antidepressants. So I think that's certainly worth talking with your provider. And then it sounds kind of weird, but another option is actually adding medications like Viagra that even for women can help in kind of increases blood flow to the genital area. And for some folks, that can really help improve or increase sexual desire or sexual experience. Long-term use of opioids can also have the side effect of suppressing testosterone levels and can really mess with your hormones. So I think it's always worth, if you're struggling with low libido, to get hormone levels checked. And I think particularly around the perimenopausal area, that is something that's really important to kind of work on. Sharon, do you want to talk any about the perimenopausal need for hormonal or maybe other things that come into play at that time of our life?
Yeah, so for women in particular, the perimenopause, menopause time can wreak havoc on our sex lives and on our libido and dryness and all the issues that really impact being comfortable during sex. And when we have problems like that, in addition to the fibromyalgia, it just makes it harder and it can make it feel like it's too much to maybe even consider sex because it's like all of these things going on that maybe aren't being addressed. And a lot of times, we're uncomfortable talking about sex with our providers. Some people are even not super comfortable talking to their significant other, their partners about sex. And I think with fibromyalgia in particular, it's really important to talk to our partners about sex because I think too often when maybe we're having issues with, the menopause or perimenopause or fibromyalgia related issues, another really important issue to consider is that vulvodynia is a common chronic overlapping pain condition that happens with fibromyalgia or can happen, with a certain subset of people with fibromyalgia. And what vulvodynia is it's a long-term pain or discomfort of the outer part of the female genitals, also called the vulva. It lasts 3 months for sure. And for many women, this lasts years and years and years, but you don't get the diagnosis until you've had this pain for at least 3 months without a clear cause. So it can be burning, it can be irritation, it can make even let alone sex, it can make just sitting or wearing certain kinds of clothing like incredibly painful. Some women can't even wear underwear. It's so painful.
Yeah.
So
And I think
it's
people might attribute it like, oh, it's just my fibromyalgia. But if you're experiencing those really localized symptoms chronically, like it's totally worth talking to your doctor about, hey, what's going on here? Because once you have the right diagnosis, you can really get better treatment.
There is the National Vulvodynia Association. I encourage you to go online and check them out. I believe last time I was on their site, they have providers that you can look into. You may be prescribed pelvic floor therapy, and that may be helpful with fibromyalgia too. But Ginevra, I know that you talk a lot about myofascial release, which is a component of the pelvic floor therapy that they do.
Absolutely. Yeah. So pain with intercourse, since we're talking about vulvodynia, pain with intercourse can also happen just kind of from the fibromyalgia, whether it's, pain with pressure on your hips. It can be hard to find a comfortable position, but well worth it, trying different pillows and things like that. And then if you're experiencing pain in the pelvic area, I always think it's worth a try to do myofascial release, which is it's like a form of pelvic floor physical therapy, so it's kind of a component of that, but it's a little bit more just kind of gentle, prolonged stretching of both the outer area, and they actually can do some internal work, which, obviously you have to be very comfortable with your therapist. Same with pelvic floor PT. It's not something that you want to just do with, anybody. Like you really have to trust them and feel comfortable. But I have seen people have huge benefits from it. And there's actually a few studies that have looked at myofascial release. And one of them, let's see, they looked at myofascial release directed at the pelvic fascia, and they found that it reduced painful intercourse and increased orgasms. And they said, and I quote, several of our patients volunteered the fact that they were having the best sex, the best orgasms ever. I will say this article was much more interesting than the usual dry scientific articles that I read, but I think it's good. I mean, even from a scientific perspective, there's some support. And then there was another study. It was small, but out of 16 patients that were experiencing pelvic floor pain, they did manual physical therapy, and 9 of 16 were able to return to pain-free intercourse after treatment with a combination of myofascial release, joint mobilization, stretching, and then some neuromuscular education, because that's often part of pelvic floor PT, I think, is kind of trying to get more in touch with your pelvic floor. And sometimes we can be really holding tension there and not cognitively be aware of that. And so I think that is also part of pelvic floor PT, and then myofascial release is kind of within that. I think doing both is important.
Yeah, and you're right. No, it is. I've been through pelvic floor therapy. So for those of you sitting there who are sitting there thinking, "Oh my God, that sounds terrible," I was one of you. I heard for years from many women who would have pelvic floor therapy about how great it was and how much just the impact it had on their lives. And yeah, I'll tell you, I was super uncomfortable with the whole idea. And so I can say it is worth finding a good therapist. And also I've had a not great one and I've had a very, very good one. And I can tell you from having both experiences that when I found a really educated pelvic floor therapist, she had ways of working with me that didn't include anything like internal or anything that I was uncomfortable doing. So don't
There's lots
feel
of ways they approach it.
yeah,
Absolutely.
so don't feel like when just going in that that is what is going to happen right away. Like I encourage you to keep an open mind about it and go in and find out what some of the possibilities are. And like you're learning here on the show, there are ways they can work with you, like with your clothes on, and start doing meaningful things. There's a lot
Absolutely.
of education, like Ginevra was talking about, that happens with it. So it's worth doing. It's worth reaching out to resources to find out where there's good ones in your area.
I absolutely agree. And I have done myofascial release, pelvic floor physical therapy, and it is really awkward at first, but then if you're working with a provider or a therapist that you kind of build trust with to really feel comfortable and safe. And if you don't like that person, if your body is like, listen to that and find someone else. Like totally listen to what your body is saying. And yeah, it can be awkward. And I often find my patients spend a couple years like thinking about pelvic floor physical therapy. And I'm like encouraging them to go, but it can take a while to kind of, I don't know, build up your courage or your energy to do.
It's obviously very personal. And so if you're healthcare providers and you're watching this show, just know that it can take a lot for a woman or a man need pelvic
Yeah,
floor therapy too
sure. True.
to get comfortable with the idea. And for some of us too, there's other considerations there, like maybe traumas and things. So you definitely have to find the right person, but don't give up on the modality. Give
Yes.
up on the practitioner
Yes.
and find a new therapist. So
Well said. Well
thank you.
said.
Yeah.
So I wanted to go back a little bit and talk a bit more about hormones. So absolutely getting your hormones checked. And if you're perimenopausal, postmenopausal, sometimes hormone replacement therapy is helpful for women as far as improving their libido and also just vaginal dryness. You can also use just topical estrogen in the vaginal vulva area, and that can actually be super helpful if you can't or don't want to take the systemic hormones. So again, awkward to talk about, but really important. And one thing people often don't realize that they're experiencing vaginal dryness, what they'll start to experience is recurrent urinary tract infections. And if you use the topical estrogen, it actually helps with that. And then it's almost like in hindsight, people are like, oh, yeah, I'm actually much more comfortable. And yeah, sex is actually something that feels good. So again, paying attention to kind of what's happening in your body. So topical estrogen can be really helpful. And then this is a little outside the norm, but we can also use oxytocin. So oxytocin is a brain chemical. It's kind of a hormone, and it's sometimes referred to as the love hormone because levels of oxytocin increase when we hug. After a woman gives birth, her oxytocin levels go crazy high, and that's part of the bonding. And it can increase sexual desire. And when you orgasm, it actually gives you a burst of oxytocin. And oxytocin actually also can reduce pain for some people. So, it's not a pill that you take. It's like a nasal administration, and you have to get it compounded. And, it's more in the realm of, I would say, naturopathic or functional medicine or integrative medicine. I've tried it for several patients, and they actually did find that it helped. I had one patient who said it made them feel just more in the mood for sex. And then I had another one that said it kind of improved their orgasms, gave them the ability to have stronger orgasms. And I was like, okay, let's do it. But the science isn't really there. There was a long-term study that looked at oxytocin compared to placebo that was self-administered by women an hour before sexual intercourse. And what was interesting is both groups actually reported about the same improvement in sexual function and desire. So because the placebo receivers also reported significant benefit, the researchers actually theorized that perhaps the real benefit came not from the oxytocin, but from the increased focus on sex and increased communication with sexual partners that was required by participating in the study.
And that communication piece is so important. You can boost your oxytocin by having feelings of love and connection to another human being.
By
So
hugging.
hugging and, and by talking to your partner and feeling more communicated and talking is actually one of the tools that Ginevra and I wanted to discuss here is get the conversation started. You can make sure that your partner knows if you haven't been interested in sex, it's not because you're not interested in them. It's because of, the pain that you're having or these other symptoms that you're, trying to figure out. And, you can ask each other questions like, what has this been like for you? What worries you? What can we do to make you feel close to me? Even
Right.
if sex isn't a possibility. And maybe it's things like cuddling without pressure or giving each other massages or holding hands or skin on skin contact, scheduling like a connection time where you just like hold each other for a little while. And there's cool studies on how even just a hug after, I can't remember the amount of seconds it took, but for like a biochemical change to happen in people's bodies. So I mean, there are ways that we can boost this oxytocin ourselves. And just circling back when Ginevra was talking about getting, your hormones looked at, I wanted to clarify that right now they're saying that you don't really need like hormone tests from a doctor. I know that some doctors are out there like testing levels, but they actually say really more taking that verbal history and really learning what your symptoms and what your symptoms are, what you're experiencing. That is like a good enough determination that the labs per se are not really warranted for knowing the exact levels for a variety of reasons.
Yeah, absolutely. They can often just diagnose it based on your symptoms. That's a good point.
Yeah. So, and you were saying too, well, yeah, that was interesting about the study, where just having that communication time and maybe more of a focus on trying to work and, time together is just
Absolutely.
so
And I
key.
think trying to find ways that can help your partner feel desired, but that are not sexual or that don't take a lot of spoons. That sounds terrible.
Oh,
Ways that you can, even in your low energy state, remind them that you are attracted to them or you want to connect with them. And it's not easy. And sometimes even couples therapy can be super helpful. And there are some couples therapists that focus more on kind of the sexual component of things. I know that's something that you have recommended for folks is like just really talk professionally. Getting some help in communicating with your significant other can make a big difference.
yeah. And sometimes, as funny as it sounds, as we're thinking about sex, you're thinking about widening your healthcare team. That's really weird, but you may find that it's helpful because, again, like we brought up the vulvodynia. So you may need, a women's health expert who is knowledgeable in that to help you. You may need a menopause specialist who is trained. I recommend going to they just switched their name. It used to be the North American Menopause Society, and now I think it's just the Menopause Society. But go on there and find a practitioner because those practitioners typically have more advanced training in understanding menopause and will be up on, the latest on safe hormones, how to take them, when to take them, if it's appropriate for you based on, your history. Again, a pelvic floor therapist might be warranted. Ginevra mentioned maybe a couples therapist, and maybe it's also time to do a sleep study or bring in like a sleep specialist too,
Yes.
if you've kind of exhausted what's happening with your physician and sleep health. So you can also think in terms of widening your team. You can also think about like what additional supports are out there, and maybe that's like different kinds of lubricants different kinds of pillows. There are so many ways to help you get more comfortable. And I'm working on putting a handout together on all this that will be available through my nonprofit, the Fibromyalgia Association, which you can visit at managefibro.org. We're working on a new website that we hope to have out to you soon with a lot more information. So there's a lot that you can do. Wanted to get the conversation started here today because people don't talk about it. And the more
No.
tools you have, we want you to have a good, strong connection with your partners. And that's such an important part of how you get through the day to
Yeah.
day.
Yeah, quality of life. And it is really important. As a doctor, I will say most takes a couple visits. Like nobody brings it up on the first appointment, but often like the second or third appointment, they'll bring in their significant other. And then one of them will sort of awkwardly start the conversation. But once you start talking about it, and if you use medical terms and we're just talking about it, it's something that everybody does. It's just like pooping. We all do it, but nobody wants to talk about it. Doctors are happy to talk about it. I'm telling you, it's part of what we learn how to help people with. While we're talking about lubricants, do you have any specific like brands that you recommend or like types that maybe are less irritating? I know some people can be sensitive to some of the ingredients in various lubricants.
Yeah, you really can. And they found that if a lubricant is too concentrated, it can actually cause more irritation and pain. So a lot of times people tend to do better with like a water soluble. And a good brand for that is BioNude. I know a lot of pelvic floor recommend that one, which is why I'm recommending it here. If you're looking for like a daily vaginal moisturizer, again, this is from pelvic floor therapists. They'll often recommend also from Good Clean Love. It's a product called Restore. And then there's another product on the market called Replens. So that's another one that you can use. And then there's like, kind of like we think of adaptive devices
Yeah.
that we would use, for other things. There's a product called O-Nuts that you can check out if you're having difficulty with pain and intercourse. And I'm going to kind of leave that one there for the audience here. But, we just want to let you know that there are products worth visiting out there.
Agreed. And while we're talking about lubricants, this is also a little bit out there, but I have had a couple patients that have used either CBD or actually just full cannabis infused lubricants. And something about the topical application of that seems to actually give some pain relief and also oddly sort of can increase the pleasure feeling. So I had a couple patients very awkwardly like, have you heard of this product? And I'm going to try it. And, you have to get it at you have to get it at like a dispensary. So probably not available in every state, but worth looking into if you live in a state where you can access medical marijuana products like that.
So a lot of good ideas here for sure.
I think, is there anything else you wanted to cover? I think we've talked about ways that we can improve fatigue. We've talked about talking with your doctor about maybe adjusting medications, talking about hormones, looking into whether you might have something like vulvodynia. Talked about the importance of communication, talked about oxytocin and ways that you can get that, whether it's up your nose or because you're hugging. And I like the hugging. I would like to prescribe long hugs to everybody. Any last words you wanted to?
No, just get creative and communicate with your partners. I mean, really, that's what is at the heart of it. Really even explore like maybe a different time of day because a lot of us don't feel good at night. So
Right.
nighttime may not be the time to
If
be
you've
doing
already
all
spent all
this.
your spoons. Yeah, that's a good point.
So, and hey, if you don't like talking about this, now you don't have to. You can let your significant other watch this episode.
You can just send it to them. They're like, hey, I'd like you to watch this.
And hopefully we will have shared all the information there that you are just struggling with some very real health problems that do have some pretty good ideas out there. Hopefully things that maybe you haven't tried yet that you could try and work together as a team on figuring out the next steps.
Well, thank you for joining us. We will see you next time. Until then, we're sending you some fibro love.